Kaduna State Ministry of Health wishes to update the public on the rising rate of COVID-19 infection in the state and to appeal for urgent action by residents to help stop the spread of the disease and save lives. In absolute and relative terms, Kaduna State is now recording high infection figures, reminiscent of the first wave of COVID-19 spread in April, May, and June 2020. The lowering of the infection rate following the first wave encouraged the government to approve the recommendation of the State COVID-19 Task Force for a significant reopening of the state. However, we are saddened to report that the conditions that compelled the 75-day lockdown of the state are now being replicated. On the 26th of November 2020, the state recorded 74 positive results from 531 samples. The quantum of infection since then suggests both high infection rates and the reality that a new wave of infections is spreading across the state. Yesterday, the 11th of December, the state recorded 117 positive cases from 518 samples. This translates to almost 1 in 4 samples testing positive, a rate of 25%. The Ministry of Health expected some increase in infections after the reopening of schools, markets, places of worship, and recreational centers. But the figures easily outstrip our estimates. While infections cut across all age groups, this new wave especially affects those aged between 10 to 35 years, and they make up 55% of the infections. These are the highly mobile group. There is now a veritable danger to lives and livelihoods with the renewed COVID-19 infections. If the spread continues at the current rate, it may challenge and overwhelm the health system, despite our best efforts to improve the resilience in that sector. We cannot allow this to happen to Kaduna State. We contained the first wave because, among other measures, most of our citizens observed and practiced the COVID-19 prevention protocols. The Ministry of Health wishes to appeal to all our people to recommit to behavior that protects themselves and their families from infection. Voluntary compliance with the protocols can help us avoid the worst case scenario and limit the spread of the disease. We had previously observed a wholesale abandonment of any compliance with protective measures. We cautioned against this and reminded citizens that the relaxation of the lockdown did not mean that COVID-19 had been defeated or disappeared. The rising infections is a reminder that COVID-19 remains a potent danger to lives and livelihoods. Anyone who remembers the pain and sacrifices of the lockdown period will not want that to be repeated. Therefore, we urge all citizens to adopt the spirit of the Forward campaign. The Forward campaign is basically encouraging everyone to follow the stipulated guidelines by authorities in the healthcare sector, and these include face masks, the wearing of face masks always, observing physical distancing, respiratory hygiene, maintaining a proper respiratory hygiene, washing hands with soap under running water or using hand sanitizers, avoiding large gatherings, remain indoors where there is no need to go out, and eating a balanced diet to boost our immunity. As part of the consultations that preceded the easing of the quarantine order, religious groups, professional and business associations, transporters, traders, and other stakeholders assured the government that they and their members will comply with COVID-19 protocols. It is now time for all stakeholders to discharge their responsibilities, comply with commitments they made, and ensure that all their members conduct themselves in ways that advance COVID-19 prevention efforts. The Ministry of Health, as the lead agency implementing COVID-19 containment measures, We'll be availing the COVID-19 task force of all the relevant data to monitor and assess the rate of voluntary compliance. If the rate of spread continues or exceeds the current space, then we will have no option than to recommend the temporary closure of public spaces, including schools, markets, offices, and places of worship. But there is a less costly way out, and that involves citizens living up to their responsibility and conducting themselves in ways that do not spread the disease. That way, lives and livelihoods are protected, while public health officials try to contain and manage the disease without causing painful disruptions. I urge all citizens, businesses, and organizations to appreciate the danger that we face and to let us all work together to avoid emergency conditions. We have done it before. Let's do it again.